Okay, so thank you so much, Dr. Sino, for the invitation and for giving us the opportunity to be part of these fruitful webinars. My name is Marawan Moustafa. I'm Education and Training Specialist for the Middle East. And in this webinar, I'll be talking about the solutions that we offer for conductive hearing loss patients. Okay, so our mission is always to overcome the hearing loss as a barrier to communication and the quality of life. Thus, we provide our users with a comprehensive set of skin intact implant solutions for several types of hearing loss. And as we are talking from scratch in this webinar, so back to basics, what are the different types of hearing loss? So the first type of hearing loss is the conductive hearing loss, and it's mainly when the problem is in the outer or middle ear. So, for example, if there is like blockage in the external auditory canal, or if the ossicles in the middle ear cannot move freely, this will cause conductive hearing loss. The second or the most common type of hearing loss is the sensory neural hearing loss, and it's simply when the problem is in the inner ear. So the nerve fibers or hair cells inside the cochlea are missing or damaged, so they will not be able to produce action potential as shown here in this nice GIF. So in this case, the patient will be suffering from sensory neural hearing loss. The third type of hearing loss is the mixed hearing loss, and it's like combination between conductive and sensory neural hearing loss. While the last type of hearing loss is the neural hearing loss, and it's simply when the problem is in the auditory nerve itself. So there are a lot of causes for these different types of hearing loss. So for example, in conductive hearing loss, it may be otitis media or acute otitis media, maybe something congenital, or if there is like perforation in the tympanic membrane. For sensory neural hearing loss, maybe syndromatic disease or meningitis can be a cause for sensory neural hearing loss. And for mixed hearing loss, it's like combination between the causes of conductive and the causes of the sensory neural hearing loss. I'm very happy to tell you that we in Medel have solution for almost all these types of hearing loss. So, for example, for the inner ear, we have the cochlear, for the inner ear problems, we have the cochlear implant. And it simply bypasses the external and the middle ear and provide electrical stimulation directly to the nerve fibers inside the cochlea. We also have the EES, or electric acoustic stimulation, and it's like a combination between a hearing aid and a cochlear implant. And it's made especially for some special cases where the patient has some residual hearing in low frequencies. So the system will provide acoustic amplification for the low frequencies in addition to electrical stimulation in the high frequencies. We also have the ABI, or auditory brainstem implant. And it is the best solution for patients suffering from neural hearing loss. We have middle ear implant, the VSB, or vibrant sound bridge, and it simply restores the natural movement of the ossicles inside the middle ear. And finally, we have the BONEBRIDGE and the ADHEAR, and they are solution for patients suffering from conductive hearing loss. So now let's have a quick look on the audiometric indications for these solutions. So for sure, cochlear implants are for patients suffering from severe to profound sensory neural hearing loss. And it also can be a very good solution for single-sided deaf patients. So for sure, the contralateral ear should be completely normal, and the affected ear will be in the degree of severe to profound sensory neural hearing loss. And as already mentioned, in some special cases, the patient have some residual hearing in the low frequencies. So the EAS, or electric acoustic stimulation, is the best solution because it will provide acoustic amplification in the low frequencies via the ear mold, and electrical stimulation in the high frequencies via the electrode of the implant. We also have the vibrant sound bridge, and it is the solution for conductive and combined hearing loss patients. So the bone conduction threshold should be within this shaded area. And we have the, and it can be a solution for moderate or mild sensory neural hearing loss. So the air and bone conduction thresholds should be within this shaded area. Finally, we have the bone conduction solution, the BONEBRIDGE and the ADHEAR, and I'll not show you the audiometric indications right now because we're going to talk about them in much more details in the upcoming slides. So here our whole portfolio for the different types of hearing loss. And in this webinar, I'll be focusing on the bone conduction solutions, the BONEBRIDGE and the ADHEAR. And when it comes to bone conduction, we are always taking a step ahead in order to provide our users with the most reliable and effortless solutions. So that's why we have two innovations in the field of bone conduction. We have the BONEBRIDGE and the ADHEAR. So now let's have like a quick comparison between the two solutions before talking in much more details about these solutions. So the BONEBRIDGE is a surgical solution, while ADHEAR is non-surgical solution. So the ADHEAR should be the ideal solution for conductive hearing loss patients who cannot or choose not to undergo a bone conduction surgery. BONEBRIDGE is for conductive mixed hearing loss in addition to single-sided deaf, while the ADHEAR is for conductive and single-sided deaf patients only. The BONEBRIDGE is an active solution, and we are going to talk in much more details later about the difference between active and passive, but simply active means that the part which is implanted under the skin is the part that vibrates. So it gives a direct vibration to the skull of the patient without the losses from the skin, while the ADHEAR is a passive solution for sure because it is a non-surgical solution. The BONEBRIDGE has an age limit of 5 years or older, while ADHEAR has no age limit, so very young babies can still benefit from the ADHEAR. So right now, let's talk in much more details about our only non-surgical solution, which is the ADHEAR. So I would like to start with the candidacy. Who are the candidates for the ADHEAR? So as already mentioned, there is no age limit, so very young babies can still benefit from the ADHEAR. It's for conductive hearing loss patients, so the bone conduction threshold should be normal within this shaded area up to 25 dB. It can be used for unilateral or bilateral conductive hearing loss patients. For sure, it's an amazing solution for temporary hearing loss patients. So maybe after like a middle ear surgery or something like this, it can be a solution for the temporary hearing loss patients. And also, it's a solution for the single-sided deaf patients. And for sure, the contralateral ear should be completely normal, and it will overcome the head shadow effect. So before talking about the ADHEAR system, let's see what are the available non-surgical bone conduction devices available in the market right now. So now we have the soft bands and the hard bands in addition to the bone conduction glasses. And I'm pretty sure that all of us can acknowledge that all these solutions have several drawbacks. So for sure, all of them apply pressure onto the skin of the patient. So this will cause discomfort and limited wearing time. And by the way, will have an impact on the speech development of the patient. All of them are unreliable. So the place of the transducer, you cannot guarantee the placement of the transducer on the right place of the mastoid. And finally, all of these solutions are not cosmetically appealing. They are visible. So I'm very happy to tell you that we don't have all these problems with the ADHEAR. So it do not apply pressure onto the skin of the patient. You can fix the ADHEAR in the reliable place, and it's cosmetically appealing. So thanks to the new principle of the ADHEAR do not rely on the pressure of on the skin of the patient, but it's a completely different concept. It relies on the suspension between two different masses. So here, if we have like M1 is the ADHEAR audio processor, and M2 is the adhesive adapter that sticks on the right place of the mastoid. So if M1 vibrates, it will transmit the vibrations to M2. And by the way, M2 will transmit these vibrations to the skull directly. So we don't need pressure anymore. We just rely on the suspension between the two different masses. And also we can guarantee a reliable placement because you can stick the adhesive on the right place of the mastoid. So it's obvious that the ADHEAR system consists of two main components, the ADHEAR audio processor and the adhesive adapter. So right now I'll talk about each part in much more details, and let's start with the adhesive adapter. So it should be placed on the hairless area of the mastoid. So as you can see here, it should be placed on this part of the mastoid, and there is like a special tool that may help the patients to fix the adhere in the right place. It's only a single-use adhesive, so you can use it just once, and it lasts from 3 to 7 days according to the surrounding environment of the patient and the skin type of the patient. It's water compatible, so the patient can use it while swimming or in the beach or in the pool. Also can use it while showering. It's safe and biocompatible according to the ISO, so it's non-toxic, non-allergic, so it's a medical adhesive safe for long-term usage. And for sure, it do not apply pressure onto the skin of the patient. And finally, it's available in different colors according to the color of the skin of the patient, so it's a cosmetically appealing solution. So now let's talk about the audio processor itself. So it snaps to the adhesive adapter via this snap connector. So it looks like this, and it should be not touching the ear pinna. So as already mentioned, it's a completely different concept. It do not rely onto the pressure on the skin of the patient, but it relies on the suspension. So it should be completely free to vibrate freely and transmit the vibrations to the adhesive adapter. Low profile, low weight. It's already programmed with 4 preset programs. I'll talk about these programs in a while. So it's really easy. Once the patient connects the adhere to the adhesive adapter, the patient will start hearing immediately. It works with only one B13 battery, so this battery lasts for a complete 2 weeks, and it's user-friendly and easy to maintain. So now let's see what are these 4 preset programs. So the first program on the ADHEAR is adaptive directionality program, as the ADHEAR has dual microphones. And the second program is an omnidirectional program, so the ADHEAR treats the sound equally from all directions. While the third program is when you connect like any audio, direct audio source to the ADHEAR. In the third program, the ADHEAR will take 50% of the sound from the microphones of the ADHEAR and the other 50% from the direct audio input. While the last program, the ADHEAR picks, mutes completely the microphone of the processor and picks the sound signal from the connected audio source. So how to change between these programs by this program change button. So you can press on this button to change between these different programs. And also you can control the volume from this scroll. And by the way, the ADHEAR is a symmetrical solution, so it can be used for the right or the left ear. Here we have the CSF44 socket for configuration. So if you want to edit something in the configuration of the ADHEAR. And here we have the direct audio input, so you can connect your mobile phone or earpod or anything to the ADHEAR by this direct audio input. And here is the battery compartment for the B13 batteries. And as already mentioned, it lasts up to 2 weeks. And we have dual microphones in the ADHEAR, so it has the ability to work in the directional microphone mode. And for extra safety, we have this retention clip to fix the ADHEAR. Also, it's available in different colors according to the color of the hair of the patient, so it's cosmetically appealing. So it's obvious that the ADHEAR is really easy solution. So you can just stick the adhesive adapter on the right place of the mastoid, then click the ADHEAR audio processor, then enjoy hearing naturally via our ADHEAR audio processor. So now let's have a quick look on the performance evaluation of the ADHEAR and some preclinical evaluation. So in this evaluation, we had a skull simulator, SKS10, and we have the loudspeakers and reference microphones, and we wanna evaluate the performance of the ADHEAR, and the results were really impressive. So here is the output force level for the ADHEAR at 60 dB. So it was around 120, and here we have the output force level of the ADHEAR at 90 dB, and the output was around 125. So it's really amazing. And when we compared these results with other non-surgical solutions, so you can see that it's comparable, and it's even much better from some other solutions. And keeping in mind that the ADHEAR do not apply pressure onto the skin of the patient, and it's cosmetically appealing. We also have some in-house audiological evaluation, preclinical evaluation. So this evaluation is to determine the benefit and the feasibility of the ADHEAR system, and also to compare it with the other comparable bone conduction systems. So we had 11 volunteers with mean age around 34 years old, and normal bone conduction and normal hearing thresholds. So the study was to compare bone conduction device with the soft band to the ADHEAR with the adhesive adapter. Conductive hearing loss was induced by using earplugs. And in this study, we measured the sound field thresholds and speech test in quiet and in noise. So the results were really amazing. So as you can see here is the unaided pure tone audiometry. So it seems that the earplugs worked well. And here we have the output from a bone conduction device with soft band and the ADHEAR, and you can see that they are almost the same. Also, regarding the word recognition score, we also have almost the same results from soft band and ADHEAR. Keeping in mind also that the ADHEAR do not apply any pressure onto the skin of the patient, and also regarding the speech recognition threshold, also the results was almost the same between the two systems. So it's obvious right now to conclude that the ADHEAR is effortless solution, as it is a non-surgical solution. It's gentle as it applies no pressure onto the skin of the patient. It's reliable because you can fix the ADHEAR on the right place of the mastoid. And it's cosmetically appealing because it's available in different colors, and it's behind the ear solution. So now, after talking about the ADHEAR, our non-surgical solution, now I'll talk about the other bone conduction system, which is a surgical solution, which is the BONEBRIDGE. So our BONEBRIDGE system consists from two main components: the external audio processor, the Sampa audio processor, and the BCI implant, BCI 602. So let's start also with the target group for BONEBRIDGE. So it can be a good solution for mixed hearing loss patients or conductive hearing loss patients, for example, an atresia patient. And also it can be a very good solution for single-sided deaf patients. So for mixed and conductive hearing loss, the bone conduction thresholds should be within this shaded area, so up to 45 dB, and the air-bone gap should be more than 30 dB. The patient should be 5 years old or older, The anatomy should allow the placement of the implant or the floating mass transducer. And finally, the patient should not have any retrocochlear or central auditory disorders. This was regarding the mixed and conductive hearing loss candidates. And for single-sided deaf patients, for sure, the other ear or the contralateral ear should be completely normal. And the patient for sure should be 5 years or older, and the anatomy allows the placement of the implant. So what is the motivation of single-sided deaf patients to have BONEBRIDGE? First of all, better speech understanding, especially in noisy situations, and better speech understanding in groups, so with or without background noise, and it will avoid the head shadow effect as well. So in general, how BONEBRIDGE works, it works when the audio processor picks the sound signals and transmits it to the implant, and the implant transmits the vibrations to the skull in order to stimulate the cochlea directly. And in case of single-sided deaf patients, the implant is fixed on the deaf ear and it will stimulate the contralateral ear. So the vibrations will move through the skull to the contralateral ear. So by this, the patient will avoid the head shadow effect, and he will not be able to rotate to the person that he is talking to. So, as already mentioned previously, that the ADHEAR is an active solution. So, what is the active solution? Also, we have mentioned that the ADHEAR is a transcutaneous solution. So, there is no extra skincare needed. So, the implant is completely under the skin, and the processor is outside of the skin, so not like the percutaneous solutions where there is like a high probability of infection and there is high risk and a lot of skincare needed. So the BONEBRIDGE is a transcutaneous solution, so no more skincare is needed, and also it is an active solution. And what is the meaning of active? Active means that the part which is implanted under the skin, which is fixed directly to the bone, is the part that transmits the vibrations directly to the bone. So it provides the best sound quality, not like the passive solutions where the part which is outside the skin is the part that vibrates. So for sure, there is a lot of losses in the skin of the patient. So the BONEBRIDGE provides the most natural hearing experience, and this results was from our first version, which is PCI 601. So it provides natural sound quality because the implant stimulates the bone directly with no attenuation from the skin. And also we don't have this unpleasant whistling. For simply, there is no feedback because the microphone and the implant are physically disconnected. They are not connected to each other. The implant is under the skin and the microphone is outside of the skin, and there is like magnetic attraction between both of them. So there is no feedback, and the patient will not suffer from this unpleasant whistling. And here is like a comparison between the output force level at 60 dB for the BONEBRIDGE and the BAHA Attract. And you can see the huge difference in the output force level. So the BONEBRIDGE is really a reliable solution. And I'm very happy right now to tell you that we have a second generation of our bone conduction implant, the PCI 602. So it is the second version of the world's first active transcutaneous bone conduction implant. It was recently launched last year, and the first surgery was by Professor Baumgartner in Vienna in August last year, and it was launched in the ESPCI conference in October last year. So what is the improvements? The new PCI 602 requires almost 50% reduced drilling depths. And I have for you a very nice comparison here. Here is PCI 601 and this is PCI 602. So in bone conduction implant 601, it requires drilling depth of 8.7 millimeters, while in the new version we need just 4.5 millimeters. So it's almost the half, and this makes it possible for the surgeon to place the FMT or floating mass transducer in any place of the temporal bone, not like the old version just in the mastoid. So it gives like much more flexibility to the surgeon, and also make the surgeon confident enough to be far away from the dura and the sigmoid sinus. Also, the FMT can rotate up to 90 degrees horizontally, and vertically it can flip up to 30 degrees. So it can take the curvature of the skull of the patient, and this makes the surgery much more easier for the surgeons. We still have the PCI lifters. So in some special cases, if the surgeon require lower drilling depths, so with these lifters, you need only 3.5 millimeter drilling depths. We also have right now self-drilling screws. So it's really easy right now, and less surgical instruments, and easier for the surgeon. Also, the BONEBRIDGE PCI 602 won the Red Dot Award for its amazing design. It has round edges with a flat button right now. So it's much more reliable for our patients. And finally, our BONEBRIDGE implant PCI 602 and even the old version PCI 601 are MRI conditional, as all our implants. The patient can perform MRI up to 1.5 Tesla without implant removal. So it's really safe for our patients. So this was for our most advanced, world's most advanced bone conduction implant PCI 602. So to sum up, it's a really easy surgery. You required almost 50% less drilling depths from our old version. We have healthy skin because it is a transcutaneous solution, so there is no skin care needed. And it is an active solution, so provides the most natural hearing experience, because the part which is implanted is the part that transmits the vibrations directly to the skull of the patient. So this was for our bone conduction solutions. Thank you so much for your time. And if you have any questions, please feel free to send me an email. Thank you so much.